Hello, everyone. Welcome to today's Zoom call. We have an exciting presentation lined up for you today on NEMSIS Research and Statistics. Unfortunately, our regular presenter, Angela Child, is out today. However, I am pleased to announce that we have a more than capable substitute who will be filling in for her, the incomparable Ben Fisher. During this session, Ben will delve into the fascinating world of NEMSIS data and how it's used in research and dashboards, benefiting state data managers and EMS stakeholders. Get ready to gain a deep understanding of leveraging this rich data set, addressing research questions, and making informed decisions. Throughout the presentation, you can expect to see real-life examples that showcase successful NEMSIS data utilization, providing practical insights that you can apply to your own work. Ben will also introduce to you the NEMSIS TAC Statistical Team, a group of experts who specialize in analyzing and interpreting data. You'll learn how to derive accurate and meaningful conclusions using the statistical capabilities available.
We now join our regularly scheduled program already in progress.
Actually, a software vendor that goes to a state office of EMS. And then from that state office of EMS, it goes to the national EMS database here at NEMSIS. Of the data that EMS agencies collect, there's a universe of about 600 elements that can be collected. State offices can elect to collect from that universe additional elements that we don't require at the national level. And then we get about 156 elements at the national level. So we don't get everything that's in our data dictionary. And I'll talk a little bit more about how to identify what is collected at the national level. This map is kind of exciting. So this is our version 3.5 map. Currently, we have 50 states, 4 territories, and DC submitting data to us. We estimate it's around 87 to 90% of EMS agencies that are required to submit data to their state are submitting. So we think we're getting pretty close to a census of data. We hope to bring on I think 1 or 2 more large agencies in the coming year that will get us actually pretty close to a census. And that presents some interesting opportunities and maybe a little bit of a challenge when trying to describe this in research because it is so close to a census. We used to historically describe it as a convenience sample. And as we get closer and closer to a census, we've kind of had to discuss internally what how to describe it best. Without saying census, because we know that in the population American U.S. government census, probably not everybody submits their form each year, but at the same time, it's a pretty representative sample of EMS throughout the country. You can see in the table. So 2016 was when we were still collecting version 2 data, and then 2017 we transitioned to the version 3 data. So you can see a pretty big dip in the number of records in states, and that was because of that transition from version 2 to version 3. And then in 2018, all the records are in version 3, and you can see that additional states and agencies continued to join. So research using EMS data. So this is pretty exciting. So if you look in Google Scholar since 2006, there are about 1,600 scholarly publications that use NEMSIS data. And I'll provide some more examples here in a little bit, but they range pretty significantly. I think when I started doing this work for NEMSIS, I sort of anticipated all of the research being either EMS researchers or emergency medicine researchers. And there have been quite a few that were economists or kind of qualitative social science researchers, and that's been really interesting to work with because they kind of approach our data in a very unique way that I don't think I would have anticipated otherwise. So that's been pretty exciting. So this is an interesting study kind of along those lines. These are 2 economists that we've worked with previously, and they looked to see if when an Uber arrives at a city, does it change ambulance volume? And we were able to work with them to create an indicator variable and then normalize ambulance volumes to determine when UberX actually came to a city, did it change EMS volume? And I think anyone who works in EMS, not super surprising that that it did. It caused about a 7% decrease in per capita ambulance rate, and they looked primarily at UberX. So pretty cool that they were able to get to that granular of a level of information, especially related to one particular type of ride sharing service. So that was kind of a fun one to work on. The other one that I think is kind of interesting to talk about, again, I don't think this will come as a huge shock to anybody who's had to work on an ambulance during a marathon, but do marathons with street barriers affect response time or actually from transport time from scene to hospital? I can certainly remember sitting at a barrier waiting to cross a marathon course with a patient going back non-emergent to the hospital, and it will affect your transport time. And so they looked to find areas where there were marathons, and then within that specific time frame of 11 of the largest U.S. marathons over 3 years. And they narrowed their research population pretty specifically, but on average, transport times were 4.4 minutes longer. And this was published in the New England Journal of Medicine. So this was another one that was pretty interesting using the NEMSIS research data. Outside of NEMSIS specifically, we do work on 2 additional projects. These are outside of the NEMSIS data program, and they involve different data use agreements with the participants. But MEMD, so this is the multi-state EMS Medicaid data set. And this is a fun project that was funded through the Office of the Assistant Secretary for Planning and Evaluation at HHS. And they are working with us as a pilot project to try and link state level EMS data, really to see if it can be linked with Medicaid data. Obviously, that's a research cohort that's very interesting. It's sort of the safety net of the safety net. So you have patients who are using EMS as well as Medicaid. And so that patient cohort is, I think, really interesting. We are in the early phases of receiving the data and finalizing the data use agreements. It's a multi-year project, so I can't give a great estimate for when the data will be available, but eventually we hope to publish this linked data set. It will be de-identified and then available for researchers. The other program that is worth mentioning with OHSU is PEDS Ready. So this takes data from several different sources: the National Pediatric Readiness Survey, Emergency Department and Inpatient data from several states, the National Trauma Data Bank, AHA, HCUP, and NEMSIS, and links them to try and measure the readiness of EDs in different hospitals in different states specific to pediatric patients. So the project includes linking death records, inpatient records, all things to try and determine pediatric readiness across sort of the emergency medicine care continuum. So some products that are worth mentioning. So the dashboards that are available are on our website. We have public dashboards that anyone can access, as well as state dashboards that only state data managers can access, as well as some for federal stakeholders. So this is an example of our opioid overdose surveillance dashboard. This one is publicly available. The information does not contain any downloadable data behind the dashboard to comply with our data use agreements, but this project was done with the Office of National Drug Control Policy at the White House to try and use EMS data to identify areas of high non-fatal opioid overdose. So this was kind of a fun one to work on, and we're working on additional projects with the Executive Office of the President that will hopefully be published very soon. So in addition to the dashboards, we offer an EMS data cube. So this is a great thing kind of in between the dashboards and the research data set. So if the research data set itself is quite large and requires some statistical programming software, if you don't have that, it acts kind of like a web-based pivot table. We do have some YouTube trainings. It's fairly intuitive. Logging in can sometimes be a little tricky or unintuitive. But then once you're logged in, it does behave very similar to a Microsoft Excel pivot table. It does have an upper limit. So as the queries get more complicated and it's trying to do more joins, you will it will eventually time out. And that's kind of where we start to recommend going to the research data set. And then the research materials itself. So we have statisticians who provide research support to requesters. A lot of them are academic, and then occasionally we'll work with vendors or state data managers. The 3.5 master's level statisticians, so that's our FTE. There's 4 human beings that actually do this work, and they have all masters in either 3 or biostatisticians, and 1 is applied statistics. And some things that they'll do and work with us on are masking and de-identification. So we can't release any data that identifies a state, county, zip code, or EMS agency, but we do have some ways to provide that data for research. So we can provide masked county, as well as link that to other research data sets. So if a researcher needed to use census data at the county level, if we provided just the census data at the county level and then masked it, you could conceivably or pretty easily reverse engineer what county the census data came from. So we will work to round or categorize or normalize that so that it is not identifiable. We'll also do unique data requests, so we can provide sort of one-off tables that are too large for the cube. We provide manuscript support, so if you use NEMSIS data for research, we're happy to review methods or the entire manuscript co-authorship, and then essentially data support related to any projects. If you have a research question in mind and you would like some help before you really get started, we do have printed materials that include a user manual for the data set, some videos. All of our data dictionaries and definitions are online. And then you can also reach out to us. We're always happy to talk about the data. Sometimes we'll kind of refer you back to some of these, especially the extended definitions, because they will provide a little bit more context about what some of the values mean for commonly miscommunicated values. Some big things to know. So the masking, like I mentioned, we can't identify any state, county, or zip code. We do have destination, home, and incident location, zip, county, and state. And then technically we can't go below zip, so we don't have census tract data, which is kind of frequently asked for in the academic world, just because a lot of the demographic census data is also at that level. So the linkage to those will be, as I mentioned, de-identified and rounded or generalized. The more columns you ask for to be linked, the more rounding we have to do. So you can imagine if there are 20 variables that you'd like to link to a zip code, you could hash all those together and come up with a unique combination of variables that would identify a zip code. So the more variables there are, the more rounding we'll have to do to try and make it not identifiable. The fewer variables there are, the more precision we can keep. The other thing I'd just like to make people aware of is the data is pretty large. So the compressed data sets are around 15 gigabytes for the current years. We just published the 2022 data set uncompressed. It's around 150 gigabytes. It's all in 42 relational tables. So you will need some sort of statistical programming software to be able to join the tables. Most of the one-to-one elements are contained in one table, and then the individual additional tables provide things like vital signs or procedures that can be kind of lengthy one-to-many elements. So when you do submit a research request, or if you submit a supplemental request, we ask for, to receive the data, we ask for sort of your research question, some of what you're trying to identify, any sort of outcome. And then as you begin to communicate with us related to either a linked table or a supplemental table, we'll ask some more specific questions, potentially what variables you're interested in using, and then some kind of basic housekeeping things, what years of data you would like, and what file type you'd like it exported as. Typically, we support SAS data and then an ASCII file type. We can occasionally export in some other file types, but not commonly. And then I think the big thing is just to have a really good understanding of what you're expecting as output. So in this example, there's a mock table of exactly sort of what you would like the columns to be, and then even some example data within it is really helpful for us to understand if you want sort of a categorized variable or a some other data type. Sometimes we will ask for just a very brief description of the research. Sometimes these requests can go into a queue for a little while, and that really helps us when we go back to look at the request and begin working on it to understand exactly what you're trying to accomplish. So even just a short paragraph in a Word document can sometimes be really helpful. To request a public research data set, you just go to our website, fill out a form, and those get routed to us. We just changed processes to go from mailing USB drives to a digital data download. So when you request data after the request is approved, you can now receive those data sets as a download. If you need help really for anything or statistical support, you can open a help desk ticket from our website, and you can request it specific to researchers or just a general request. Those get kind of filtered and assigned throughout the day, and those will go to the most appropriate person. And then we will be able to get you help. And then just keep an eye out. Every now and then the JIRA tickets will go to your spam folder. And then we can refer you to the appropriate resource or get you started. Again, the easiest way to get a hold of me is through the NEMSIS help desk. And I'm happy to answer any questions either in the chat or actually, we're just going to do the chat today based on this morning. All right. Well, Chris, I know that was pretty lightning fast. Like I said, please reach out to us if you have any questions. We're more than happy to help or answer any questions you may have. With some editing, this video will be posted on YouTube as well as a refresher. There are some other resources that are posted, and we're always happy to answer any questions you may have.
Awesome. Great job, Ben. Thank you very much for the information. If you do have other questions that come up throughout the day that you had about the information that Ben presented, please feel free to get back in touch with us. Use the submit a ticket button at the nemsis.org website. And but other than that, I hope everyone has a great rest of their day.